All right, so welcome to this inaugural interview of SIM Leaders. This is an initiative run by the SIMDFW Fellows, which is a group of people that has been recognized for their contribution for years of service, both to the chapter as well as at the national level. And our idea is to put together interviews, specifically personal stories of SIM members, in order to use those stories to get ideas and use as resources in this era of COVID-19, which is incredibly challenging for a lot of us. So the idea is to provide resources for managing in this time of COVID-19 for both SIM members as well as students. And I'm very pleased to have our first interview here today. My name, by the way, is Ulricke Schultz, and I am a faculty member at Southern Methodist University in the ITOM department, Information Technology and Operations Management. My first interviewee today is Debbie Jowers, who is the Vice President of Ambulatory ITS Services for Texas Health Resources in Arlington, Texas. Debbie is a veteran of 27 years in the healthcare space and is currently responsible for all the IT needs for the Texas Health Resources wholly owned Texas Health Physicians Group, which comprises of 250 plus clinics, 1,000 providers, and 2,300 employees. She's also responsible for the IT needs of Texas Health Resources ambulatory joint venture facilities, the Texas Health Resources IT liaison for the Southwest Health Resources clinically integrated network with UT Southwestern, and the IT needs of the Chief Experience Officer and the digital health teams. She is also the 2009 winner of the CIO Magazine Ones to Watch Award. And she has been an incredibly active member in the SIMDFW chapter with the multiple roles on the board, as well as the past president of the chapter. And with that, welcome, Debbie. Is there anything I left out of your background or vita that you'd like me to, or that you'd like to include or add?
No, that's good. After 27 years, you have to learn to condense it.
Well, it's impressive. So, Debbie, where I wanted to start was to get a sense of how COVID-19 has impacted you, at this point in time. What are the kinds of, issues, challenges that your organization is facing?
Well, when this began about, I guess, 6 or 7 weeks ago, there's times when I think it's been like a year, but it's really only been that long. We got a lot of scenarios coming at us. What if this happens? What if this happens? And planning, and a lot of guessing as to what is the government and the payers going to do in this situation. So for us, it's been, early on, it was a lot of data. It was a lot of what's going on in the hospitals, how many sick people do we have, what's going to happen. But as things started to change and regulations changed, it became a flood of ITS requests, and can we do this? Can we do that? And I think for me, the first 2 weeks of this was all email, all of the processes when you have a crisis, they just go out the window, right? Lose their brains and don't remember the processes and just email things in. So the first thing we had to do from a leadership perspective was get a handle on how we were triaging these things. And really, from my perspective, I usually take the lead in a crisis on something like that and just sort out what's coming in because it's really about keeping the noise off of the people who are really doing the real work, right? So that they can get things done and they don't see all this. And then we sort it out at the leadership level. Here's what we're going to tackle. And the THR had the senior executives leading meetings twice a day. So they would start at 8 in the morning, had one at 9, they'd end the day at 4 o'clock. And I'll have to thank our CIO, Joey Sudemeyer, because he realized real quickly that we needed to get an end of the day IT group with all the leadership, which are the directors and above. Because with all these things coming in, people panic, right? And they don't, sometimes they don't know where to go. So people were reaching out all over IT with the same thing. So what we found quickly happening was, okay, we got multiple people working on the same thing or going in different directions. So that daily leadership meeting probably was critical to getting a handle on a lot of this.
Mm-hmm.
You know, for me, I look at it from a leadership perspective, and you have to keep the order and you have to keep the chaos out of things, because if people see chaos, they're going to get worried.
Right.
So that was one of the things that I just take a deep breath before I go to meetings, you know, do a little yoga breathing in and out, level set yourself, and just keep calm. That was probably the biggest, and it's hard because we're all virtual.
Right.
Quickly, we were all sent home. Most of our IT works from home anyway, but from a leadership perspective, we normally don't.
Mm-hmm.
So that kind of connecting with our teams and making sure that they were all okay and what are we really working on,
Mm-hmm.
things. We had a very big challenge right off the bat with facing with the clinics. Well, what if COVID would close these clinics to protect people? How are the doctors going to continue to see their chronically ill patients? Because they have to manage like people with diabetes, you know, heart congestion, things like that, to keep them out of the emergency rooms at this time, because it would have been even more dangerous for those patients to go to the emergency rooms with the flood of COVID. So we had to quickly stand up virtual visits, which we had been working on, telehealth, but we weren't quite ready. So we had to kind of put that to the side and then go, all right, let's just launch with Skype. You know, everybody has to schedule a Skype meeting. You schedule the appointments, you send out Skype, and you get it up and running. And within probably less than a week, we had 110 clinics launch in one day. And, you know, even right now, we're doing and seeing probably close to 2,000 people virtually a day throughout our clinics. So not only does it protect the patients, it protects our providers and all of them from getting COVID. And it certainly, since the payers relaxed the payment rules on paying for virtual and telehealth visits, that's helped keep some of our revenue going as well, because you can imagine when you shut down a system our size of all elective procedures, that's a pretty major impact from that perspective. So
Right.
I think the other thing, when I look at all the things that we're doing and launching, I had a previous person I reported to, CIO, who always used a phrase, don't let perfect get in the way of good. And during this crisis, we have used that extensively. It's good enough, let go with it. And I think that's hard from an IT professional people. They want it perfect, right? So we had some challenges getting people over that hump with that. But I think the other challenge that we've had is keeping people's spirits up, because there's been a lot of long hours, 7 days a week, getting changes made, changes that we know we're going to have to back out, because this is all temporary, many of these things that we're doing. So keeping track in our tickets of what has to be backed out, that was one of the first things we did, was put a flag on our ticket system to say, I've got to back this out when this is over. So you know, we've done some virtual happy hours with our team. You know, and from my team, they like hearing from the leader, even if it's just, hello, you know, thank you for what you're doing. Just, you have to stop and remember to send those out to your people as well. So just kind of some high level about some of the things that we've been facing and some of the leadership skills.
Yeah, and boy, that sounds, I mean, the scope of changes that you had to make with, you know, getting all those clinics into virtual meetings, that seems just huge. And
It
you know,
is.
the mantra of good enough, right? I think
Yeah.
is really the only way that you could make that through, could make it through that. So that's really a fantastic insight. Thanks for sharing that. So what I wanted to move on to is, you know, you obviously, when you were talking, you already indicated, you know, this is what you need to do as a leader in a time of crisis. So obviously you've had prior experiences with crises, and I was wondering whether you could share one of those experiences with us, you know, to give us an idea of, you know, what can we draw on to learn for this particular crisis?
You know, we've all had those system outages that don't go as planned and come down. But when I look back on this and one other one, those really weren't crises. This is a crisis.
Mm-hmm.
And ironically, back in October of last year, the Texas Health Physician Group's headquarters in Dallas was hit by that tornado that
Oh,
came
wow.
to us. So it basically wiped out the main headquarters where the execs was, and unfortunately our large lab was in that building as well. And the other two buildings that we leased there were also damaged, so everybody had to evacuate. I remember getting the call on a Sunday night at 12:30 in the morning, you know, the headquarters are damaged beyond, you know, things were flying out the windows and, you know, the basic tornado thing. So that was probably the second. That's a lot level lower of crisis than what we're facing. But at the time, we thought this is terrible, right? So it's the same thing. We quickly gathered the leadership, met twice a day, prioritized what's coming in, what's the highest impact to the operations, because our clinics were all okay. It's just the headquarters and all of the people who support all of those clinics were there, and suddenly they're having to work from home. Their equipment's sitting in a tornado damaged building. Quickly, even my team that serves all the clinics, all of our equipment was in the buildings that we stage out to the clinics, and luckily that building had the least amount of damage, so we were very lucky. But you know, we had to get a restoration company to come in and sort through all the damage and box up everything, and then we had to go through it all. It was weeks and weeks, and ironically, we just finished the inventory of what was damaged in the tornado about 2 weeks ago, and we were saying, okay, our tornado has now crossed into the COVID world as we wrap this up. So we went into other, and it was the same thing. You know, you've got to have one person take the lead, keep track of everything, which I did, you know, be the traffic cop, if you will. I need, you know, you, Sally, over here. Jane, I need you to do this tomorrow. We got to go to, you know, and actually it was interesting because I am very proud to work for Texas Health Resources, but it made me even more proud to watch as our hospitals came forward to the physician group and said, look, we've got some space here. We can put some people here for you. You can stand your lab processing back up in Dallas. I mean, they reached out, and it really made me proud to work for HR at that time.
Right, right. So, I mean, as you told that story, there were a couple of things that I felt I heard, you know, in terms of what can we learn from this, right? So, first of all, prioritize, right? That was one of the things that you talked about. And I'm wondering, you know, to what extent is prioritizing easier at a time of crisis than it is normally? You know, so what are your thoughts on that? It seems
I
that
think,
it could be easier.
yes, I agree. I think it is easier because people see there's a bigger problem or a bigger issue than just themselves, right? And it becomes about what's good for the whole group. Who's the highest priority to get up and running, right? The lab, getting that lab back in place was our highest priority. Obviously, we couldn't get it back in place because the equipment was damaged. So we outsourced some of it, but we had to get a processing because we had 250 clinics that were drawing blood every day, and we had to get those specimens completed for those patients we're testing, waiting on. So you know, we outsourced our lab to another lab company and got all the processes in place. And people become more patient in waiting for things. And if you give them, like, I'm sorry this laptop is old. This is all I got for you to take home. They're like, it's fine, as long as I can do my work, right? Whereas in normal time, it would be like, well, I need this right now, right?
Right.
So I think it's actually a lot easier to get people to come together and agree.
Right. And I think the other point that you were making, you know, in terms of the, you know, the crisis that you faced with regard to the tornado, that people essentially reached out to one another, that there was sort of a sense of community almost
Yes.
to resolve the issue. And I think that fits very closely to what you were saying right now about prioritizing becoming easier once people are less concerned about themselves and more concerned about the big picture.
Yes, yeah, it definitely is. It's COVID-19 has been a little bit different with this because it's, you know, everybody normally in a crisis looks to IT, right, to help solve things and fix things and do something. But we look at this, and this is all about caring for people. This is about the nurses and the doctors. And no matter technology that you throw at this could prepare anybody for what those doctors and nurses are facing. So we just have to keep in mind, this is what we have to do. You know, ironically, and I'm sure you've heard it on the news, you know, conserving the mask and the personal protective equipment is one of the #1 priorities, which is why we had to quickly do virtual. We have virtual triage going on in the ERs. If the patient appears to be symptomatic and pretty bad, then we can there are iPads in there that the doctors can virtually look at them and go and save themselves and save equipment, going, yeah, we're going to send you out of here to get testing, right? Get tested. So this one's been a lot different.
Right, right.
But
still
basic management.
Beg your pardon?
It's still basic management, you know, of people and leadership skills.
Yeah, yeah. So any other lessons that you would say? I mean, you know, I guess I pointed to, you know, for me, what was so compelling about your story was, you know, that in some ways a crisis might make things easier, right? In terms of getting people to agree on what is the priority and getting people to cooperate, you know, and possibly a little bit more than under normal, you know, circumstances. But were there any other sort of lessons that you drew from how, you know, Texas Health Resources and you in particular dealt with that crisis?
I think in times of this crisis in particular, realizing within a week or so, we realized this isn't going away very quickly, right? So keeping up your own personal strengths, you know, keeping up a good exercise routine. If you exercise, still eating well, not, it's so easy when you're working virtually to just sit down at 7 a.m. and look up and it's 7 p.m., right? You have to take care of yourself, your mind, your own sanity through this, or else you're no good to your team. So you have to learn when to say, okay, I've done the best I can do today and I'll pick it up tomorrow. And then go take some time for yourself. That's been very important as well. We try to encourage our teams to do the same thing. It's but sometimes they're so dedicated, right? They want to just get that last thing done or work on a Saturday, and you just have to say, you know, get off the computer. Time for yourself.
Wow, that's pretty amazing, right? Pretty amazing. So Debbie, any other lasting thoughts on either the crisis or crisis management in general in the IT space?
No, the only thing I will say is I don't think anything you do in your normal operations, your normal processes can prepare you for something like this, for COVID-19. You know, it's a whole community impact. You know, things like a tornado, well, you can have your disaster recovery, you can have your business continuity plans, and you better have them up to date in case one of that happens. And one of the things we laugh about is we gave all of the different leadership levels laptops, right, for business continuity, So you're supposed to take them home every night. They're supposed to be home. I would say 50% of ours were not where they were supposed to be, and they were in the buildings in the tornado. So it's a matter of if you have the plans, make sure you practice them and remind people.
Yeah. Very good. Very good.
Mm-hmm.
Well, Debbie, it's been really interesting and eye-opening for me to listen to your story. And I think on behalf of all of us, thank you very much for your service, especially at this time of COVID-19. I think, maybe we underestimate, we talk a lot about the people, physicians and nurses on the front line,
Yeah.
but the kind of work that you and your groups are doing, I think is such an important infrastructure and support piece. So thank you to you and your team for all your dedication and hard work.
Well, thank you.
All right, thanks so much.
All right, take care.
Bye-bye. Bye-bye.
Bye.
Now I don't know how to stop the recording. Why is that?
Oh, there should be a recording off.
Golly, I can't see it. Don't tell me I didn't record this.
Oh,
there it is. No. I've got it at the top. Oops.